We're just talking about the Jiggers campaign that a Hardy Trust have been going through for the last 5 years. We had Cecilia Mwangi, and she told us about the plight of thousands of Kenyans who are not able to be treated for the Jiggers that they have in their feet because simply they don't have money. Now, we're moving on to another equally important, probably even more important perspective, especially when it comes to children's health. The world over, Kenya is not an exception. When it comes to the issue of sanitation and the diseases that it causes, it's a big problem. It takes a huge chunk out of the Ministry of Health's budget. And the biggest cure, as has been said many times, is prevention. And there's one company, as you know very well, Unilever through Lifebuoy have been pushing for policy and have also been encouraging through campaigns and so on and so forth for people to simply become cleaner using the means that they have. There's one lady who happens to have a PhD in hand washing. Yes, I said it, a PhD in hand washing. She covers over 50 countries the world over, and we're privileged to have in studio this morning Dr. Myriam Sidibe. Very good morning to you. Welcome to KTN Sunrise Live.
Thank you very much.
I know that took people off balance. A PhD in hand washing.
Indeed.
I was asking you, how and when do you get that? And where do you get that?
So basically, I'm trained originally as an engineer, and then I decided that basically the infrastructure use was so much more important than just building the infrastructure. So I decided that what I wanted to do is to start thinking of how do you get people to use their toilets more and to use their sinks more, because I realized that from a public health perspective that made a huge difference. So I enrolled in the London School of Hygiene and Tropical Medicine over 12 years ago now, and then I said, look, what can I do to get a PhD in public health that's focused around behavior change? And then the only funding that was available was hand washing with soap at the time. So I spent 6 years observing 3,000 children washing their hands, coming in and coming out, and then I ended up getting a PhD in hand washing with soap.
Wow. So it's not a joke.
It is not a joke,
but
indeed.
Even more so, what really shows that it's not a joke is the fact that the people who die from simply not washing their hands.
Absolutely. I think today, if you look at the diarrheal rates across the world, we're looking at about 1.1 children of under 5 that die every year due to diarrheal disease. And we know that scientifically today, if you could wash your hands at the critical occasions, we could reduce this by over 50%. So this means that regularly we could save over 500,000 children every year.
And 50% of the deaths, if people, or especially parents, told their kids to simply go and wash their hands
at the right occasion, so before food and after toilets. I think it is important to emphasize on the right occasions, because those are the moments where the pathogens are transferred. And then before the children actually eat, then they come back from school, they've picked up all sorts of things. But that's the mortality side. But what about the children actually getting sick, and that basically they miss school because they're not, they've been sick with flu because they've just received it from another child in school and they've passed it on through playing and through their hands. And so on the morbidity level, the burden that it caused to the society of Kenya and across the world is huge. Children stop going to school, they miss more school, and then they miss exam and they miss years because of diseases that can be avoided if hygiene was more prevalent.
I mean, I'm sure there are parents who are listening to this, the people who themselves need to wash hands who are listening to this interview.
Yeah, absolutely.
What pieces of advice, I have to use the name advice, because we do need it once in a while, do you have for people in terms of simple measures of hygiene? Because I like the way you put it. I mean, you have this PhD, you have all the details in the world, very complex, but you're telling them, let's narrow down to the simple, basic things.
Absolutely. I think one of the things that we've realized that works the best is to make everybody believe that everyone else is doing it, because no one wants to be the one who's not washing their hands. So I think one of the best things to do is to think, look, I can't change the world, but I can change myself. From now on, before I eat, I will get up and go wash my hands. You will be surprised. A lot of people will follow you, because it is not because people don't know that they should be washing their hands. They get lazy. The water and the soap is a little bit further away. It's not available at the right time, at the right place. Oh, we forgot to buy the soap. But I think if we start creating societies where we all say, look, it is important to wash our hands, then it becomes a norm. And I think that is the most important thing that I would say people would need to pick up.
So what you're saying is that this is not something that affects young children only. It also affects adults.
Yeah, I think the interaction between the mother and the child, the mother who needs to be the role model and the child who needs to practice, it's very tight. So you can tell the child to wash his hands as a mom, but in reality, if every now and again you skip, then the child will look at you and say, well, you know, it's okay if I don't wash my hands.
It's not that serious.
It's not that serious. My mom is not washing her hands. So I think it is important that, you know, as parents, we stay role model. And as children, obviously, we create the right environment so that they can actually have the soap and the water available to practice the behavior.
I mean, let's go to something that I'm sure some people are asking. You know, the people who simply don't have that soap, don't have that water, and they're like, good that you're saying it, but the problem is we don't have it. What do you have to say to people who tie these issues such as diarrhea, cholera, and so on and so forth?
No, so I think it's a very important point what you raised, and that's why we are working with the government of Kenya. We've been working, for example, with the Ministry of Public Health and Sanitation, and for example, in some of the schools we build sanitary facilities and bring water as well. But I have to say that the biggest issue is not necessarily penetration of soap or penetration of water. So I'm not asking you to use one brand over another brand. I'm asking you to use any soap. So you will find that the soap is available. You will find that there's always a little bit of water, but the reality, it's not being used at the right moment. And I think that's where we need to really push ourselves and to say, look, can we do something so that we can actually ensure that at least the right moments are embedded? And then work in parallel with the government, work in parallel with NGOs so that we can build the infrastructure and make it easier for people where it is very difficult, because indeed there are areas, you know, in Saharan country like mine, for example, in Mali, or in some parts of Kenya where access to water is very difficult. And those are realities one needs to take into consideration as well.
I'll go back to that. This disease is tied to poverty. Is there an inverse relation to that, or is it a direct relation to
I think yes. I think most of the public health diseases at some point or another relate back to poverty. So you cannot completely rule out, because the reality is, you know, you need to have the facilities, you need to have the means to be able to have a constant supply in order to practice constantly. So I don't believe that, for example, richer people are cleaner than poorer people. I think that is not at all the point. The point is, I think everyone would wish to be exactly the same, but the reality is they cannot always afford. But there, you know, it is true. So I think we need to work hand in hand with income generations and other activities. But as a company and as what we can do, we can at least put our skills of good marketeers, of aspirations, to get people to practice the behavior. And that's our responsibility.
So far? Is it working?
It's working so far. So what we've done as a company is that we've taken a commitment as part of our Unilever Sustainable Living Plan, basically, which says that, you know, we'll double our business, but the reality is we'll double our business with minimizing our environmental impact, as well as our improving our social goals. And what we've decided we were going to do is we were going to change the behavior of 1 billion people by 2015. 2015 is the year of the MDGs. And you know, it's a big, ambitious goal. It's spread across countries. Kenya's share of this is about 8 million. So the objective is
8 million of what?
8 million people that we need to change the behavior. So we need to ingrain into 8 million Kenyans that they need to wash their hands more regularly and that more frequently. And I think that will have a huge impact, and in terms of public health, and it will have a huge impact overall also in terms of business.
Another very important thing is even as the private sector tries to do all of these things, especially at this particular time, we just had the World Health Day on the 7th of April. Yeah. Do you feel like you're being met halfway by policies stemming from government and, of course, the public sector?
Absolutely. I think this World Health Day was about, you know, adding more years to your life. It's about aging. And I think our message goes very well hand in hand with that, because a lot of what you can do for prevention will add more years to your life if you can inbuild these habits into your everyday routine. So, I mean, the idea is not to work in isolation. We are very clear that we can't achieve all these goals if we don't work in partnerships. So yesterday, for example, we launched our school program campaign, which is going to reach over 300,000 children this year in Kenya, with the Ministry of Education and the Ministry of Public Health and Sanitation, and a few other NGOs that we work with, such as WUSUP, the Water Supply for the Urban Poor, and PSI, Population Services International. Now, the idea being that, you know, it's only by combining all these skills or those networks that we're going to pass on the message more meaningfully and to more people. Great.
Now, I'm going to put you on the spot. As you were watching the interview we had with Cecilia, and on Sunrise Live, we always try, if possible, just to, you know, put a spark in people's lives, give people hope. I mean, we mentioned to them that you're the first lady to get a PhD in hand washing, and they've also mentioned to them that you're an engineer, and I'm sure people are like, please, to give us a profile, give us a profile of Dr. Myriam. I mean, how did you get to, you know, being an engineer in the first place, being a humble girl from Mali, going all the way to becoming, you know, where you are right now? Tell us your story briefly before we wind up.
I think I've been very lucky. I've had parents that have always made education central to what we were about to be. They always told us, look, we're poor. We're coming from a place where, you know, look, we're not going to give you much heritage at all, inheritance at all, but what we can do, and we're lucky enough that we're working for the UN, and my parents are both UN workers, and that we can secure
you. This was in Mali?
I grew up in Mali until end of primary school. Then we started traveling around. This is my 20th country I've lived in.
20th country?
Yeah, 20th country I've lived in, and growing up as a child and then as a professional.
Wow.
Yeah.
So how did you decide that you want to become an engineer?
I have to say, I've always wanted to do social, but my dad said at the time, look, I'll pay for your studies. It's very important for you to do something scientific because this is how you get a job. But then you can do what you want afterwards. So I think he tricked me. But he tricked me well because I think it gave me the kind of rigor to be able to then become a very good social engineer. So yes, I cannot build anything because I've never really practiced as an engineer. But I think the rigor and the understanding and the detail is something that I've gotten from business.
And where was this? Where did you do your...
I did my engineering in Canada, in McGill University.
Okay, then you proceeded to do...
I did my master's in the UK in water and environmental engineering. Then I worked in Burundi, I worked in Rwanda, I worked in Uganda in emergency development and IDP camps. And then I decided to do a PhD at the London School of Hygiene and Tropical Medicine.
And then you came to Kenya?
No, then I moved to Senegal for the World Bank for a while for doing my data collection. I worked in Indonesia and East Timor for a while. And then I basically got recruited by Unilever, created this position, and modeled it to what we think could be useful for both the business and the world. And then moved to India for 3 years, and now I've just moved to Kenya.
Wow. Yeah. No wonder you're in charge of 55 countries. I'm sure you know all of them, you know, and their corners and so on and so forth. But when it comes to the people that you're talking to, I mean, we've had, as I've said, we've had two brilliant ladies, yourself and Cecilia. You both did engineering. What message do you have for young girls who are starting out in life? But not just young girls. There's also young men who are also starting out, and they're listening to you and they feel inspired. But what are some of the tips that you can give them?
And I think it's a very important question, and I do lecture across the world. I lecture at Oxford, I lecture at Wharton, and one of the things that I actually do is to actually try to always have a mentoring session for people that are out there doing degrees that are already set up for them, saying, look, you can do a degree, but never forget that that's only a structure. What you want to do needs to be guided by what you love. And if what you love is to help people, that's the line that you need to keep moving on. And then I think, you know, I never thought today I would be where I was when I started, in the very sense that, you know, I did have a vision that I wanted to do something pioneering, but then the pioneering came as I put all the pieces of what I was doing together. What I don't believe in is starting fresh all the time. I believe that you need to build on what you have done in the past to continue putting the building blocks together. So I would say stick to finishing basics. So do finish your university degrees, but don't necessarily think that you need to be stuck in one place because the horizons are unimaginable.
Yeah.
And I think that is the most important thing to keep in mind. And you can be anything that you want to be if you love doing that.
What's the one thing or two or three or four or five things that you would say now, you know now, that if you knew 10 years ago, 20 years ago, that have really helped you a lot?
I think that have really helped me a lot. I think being extremely adaptable. I think I've been very lucky that indeed I've moved around and all that. But I think being in a situation where you can always adapt to the situation and blend in, because I really think that that makes all the difference. If you want people to help you, to support you, they need to feel that you can understand where they come from.
You're one of them.
Yeah, and you're one of them. And I think that for me is number one. Number two is positive attitude, because I think that, you know, you can get anything you want in the world, but if you're not capable of framing it in a positive manner and seeing how you can reach out to people in a positive light and make a difference in their everyday life so that they feel good about themselves, then you've actually failed. Because ultimately it's about the everyday that you're going to take. And so I think the positive attitude is most important. And I think thirdly, integrity. Because ultimately you are accountable, and you're an accountable person of society. And as an African today, and as you know, everything that's going on in my country right now,
yeah.
You know, so as an African, as a lady, I think it's important that we all stay very accountable citizens and keep our governments and keep the companies we work for accountable for what we could do in societies.
Fantastic.
Yeah.
Again, I'll put you on the spot. The biggest mistake that you ever made?
Biggest mistake I've ever made? Wow. Wow. I've done quite a few. Biggest mistake I've ever made. Wow, that's a difficult one to answer. I've done a few things that thinking back, I probably would have done differently. But there's nothing out there that I fundamentally regret. You know, I just think regret is such a wasted emotion. So I have lived, I have loved, I have been around for people, and I hope, every interaction that I've had, continues being. So I can't actually point out one right now. Sorry.
And I get, no, it's okay. We just wanted that very sincere answer. And, I must say thank you very much. We'd swayed a bit, but I want you to finally just give a comment, especially on sanitation, as we wind up this interview.
I think it's important that all of us take up on very simple habits, and I think hand washing with soap is an important one. And we're proud as Lifebuoy to be able to bring you that message. So we hope that we'll be able to bring it to more and more households in Kenya, and that you see us as a potential good family ally and a good brand to bring into your home. Thank you.
Well, thank you very much. Dr. Myriam Sidibe joining us. She's in charge of the global, it's called the Global Mission.
Global Social Mission.
Global Social Mission, a fantastic project. Yeah. And I'm sure you've really, as you've said, making people feel like you're one of them. There are many people out there who've really, really appreciated, what you're doing, especially after all the accolades that you have. You could have chosen to do anything else in the world, but you specifically chose to go for the forgotten. So thanks so much for taking time to come.
Thank you very much for having me.
Live this morning. That's it for the interview segment. Remember, you can catch such fantastic interviews and fantastic guests, professionals, people who will inspire you. They'll get you moving, like Dr. Myriam Sidibe here on KTN.